Hi there.
Afternoon, Mayor.
Good afternoon.
Good afternoon.
Kirk, were you on the field over there with the graduates, or?
No, I'm at Bryan Hall looking out the window at all these great, very happy people getting their pictures taken.
Yeah, yeah. It's awesome. You should stand in the window so you can be a part of it.
Yeah.
Mhm. All right, terrific. Well, it's 1:15. Looks like we are live on social media, and welcome everyone. I know I'm not the face you're used to seeing on Friday afternoons at 1:15, but you'll have to put up with me in the meantime as Chuck Carney is receiving some well-merited recognition for his recent academic achievements over at IU. This is, of course, our weekly press call on the community's COVID response. I'm Yael Cassandra, the Director of Communications for the City of Bloomington. And joining us today on this call are Bloomington Mayor John Hamilton, as well as Monroe County Commissioner Penny Gibbons. We have the IU Health South Central Region President, Brian Shockney, with us today, Monroe County Health Department Administrator Penny Caudle, the Monroe County Emergency Management Deputy Director Kate Petroline, and IU's Assistant Vice President for Strategic Partnerships and IU COVID Response Unit Lead, Kirk White. I hope I have gotten all of that correct. Quite a mouthful there. So I think that we will proceed in the order that we normally do, with Mayor Hamilton heading us off.
Great, thanks a lot. And congrats to Chuck for today. And thanks, Yael, for stepping in. Just a quick numbers sharing. We now are at about 40% fully vaccinated. Our staff, 338 people, have applied for the $100 Wellness Award, showing they've gotten vaccinated plus 2 weeks. So we're happy about that. Don't want to see that keep climbing. Our employee case numbers, we had 2 new this week, bringing us to 84 total. I do want to note a particular thanks to our county leaders, particularly in light of this ill-advised Senate Bill 5, I guess is the name of it, the state law. But we know we have great support from our commissioners for the health experts. And while it's an ill-advised law, from my perspective, we're very, very lucky. And I want to thank the county leadership, which we know gives such strong support to the health experts. The state numbers, and you all can see this, of course, are not moving down. They're not going in the direction we want. There's not a dramatic change, but just as an example, the daily case average in the state of Indiana was in the 900s a couple weeks ago. It's now over 1,100. That's not a dramatic difference, but it's not going the right direction. We're still watching locally for the really definitive direction movement, and not seeing that. I don't think generally, maybe IU numbers were a little higher this week, and maybe hospitalization's a little better, but overall, I just think we're still really just watching what's going on locally. I will say, I think that the focus on the vaccination numbers is the key to make sure that we keep moving that up. As many have seen, and we're all getting educated, even if we don't make population immunity or herd immunity, which some of the experts are now suggesting may be difficult, there's still a lot we can do. Indeed, it's kind of hit me a little more that maybe the local vaccination numbers just in our area are more important than we may have thought compared to everything else. That is, even if the state or the federal is at one level, if we can get our local vaccination numbers up higher, that really can help our community, even though we have visitors and even though we have a lot of interaction, of course, with others outside the community. If our resident community can get our vaccination numbers up, that can really be of great benefit. And it means encouraging all of our institutions to do what we can do to help move that number forward. It means encouraging each individual to consider what they can do move that number forward ourselves or with friends and family. And it kind of reminds me a little bit like back at the beginning of this a year ago, when we kept saying how we behave will determine our future. And we've gone through a period when we were waiting for vaccines, and there's a lot of things that were out of our control. But those are here now, and in a really important way. Again, what we do, how we behave locally, can really affect our local chart, our local path. And if locally we can get our vaccination numbers up, that may really help us, even if other things don't go as well around us. We did that well in 2020 locally with precautions and protocols and supporting each other and coordinating that. And I think maybe if we can do that again at this local level, maybe to me, it's kind of emphasized that a lot that we do locally may really affect the next 6 months or 12 months. So we'll continue to report on that. And again, it's just really about the vaccinations. We're racing against variants and other things. So let's keep working on that, and happy to take questions at the end. Thank you.
Yes, indeed. Next, we will move to Monroe County Health Department Administrator Penny Caudle for your comments.
Great, thank you very much, and thanks for joining us today while Chuck and all of the graduates can celebrate. So we're congratulations to every one of them. What a year to graduate, right? Last year was certainly something, and this year to be able to say that you can actually make that event, that's pretty great. I really want to start off by saying thank you to our nurses. This is National Nurses Week, and we want to thank all of our staff nurses, our volunteer nurses, and every nurse out there working every day. So thank you for the work that you do. That's really where I wanted to start. New guidance continues to come out, and certainly there is camp guidance out now by both the Center for Disease Control and the Indiana Department of Health has chimed in on some of those things for Indiana. So that information is being shared. So anyone who is planning daycare camps, those kinds of overnight camps, day camps, that guidance is out there for you to look at. Summer school guidance is expected to be out next week. So we are anxiously awaiting additional guidance as it comes. Monroe County does remain in a yellow advisory, and that is really based on that 2-metric system for the state of lower positivity rate, but our cases per 100,000 is in that moderately high level. It's over 100. So we are in yellow advisory with kind of that combination of an orange and a blue if you look at those metrics individually. More hospitalizations, I believe, are occurring in younger people, and we'll always hear from the hospital in terms of what's happening currently. While deaths are still occurring, and we have added several deaths this week, we are seeing a drop in frequency in our deaths, and we believe that much of that is due to vaccinations. We know that the majority of people in our community who have been vaccinated, the highest percentage group is those individuals over 60, and we thank them for being vaccinated, and we are seeing it make a difference. A few things that I want to make note of is that positivity rate may increase a little bit as we see a decrease in the amount of testing that is done. Our cases per 100,000 have vacillated a little bit. You might say that they're sort of at a plateau. This week, they came in at 124 cases per 100,000. Last week, it was 105. The week prior, it was 123. Now, as I looked at that today and just kind of looking back in those last few days, I think we're making some improvements. That's hopeful, but we will see where that ends up, because one single day can change those numbers. We are continuing to have variants identified throughout Indiana, and there is data on the dashboard now that includes variants that is being found through the surveillance program on that. The other thing that I want to talk about is we all kind of work and hope to get to that blue advisory is remember that is that 2 metric system that I talked about. So when we are still having a low positivity rate, but our cases per 100,000 drop below 100, we will return to a blue status, but we still have a ways to go. Our big goal is to have minimal community spread, and that would be less than 10 or less per 100,000. So it'll take a while to get there, but there are certainly things that we can look forward to as we move to that stage. The Board of Health did meet this past week. They did not make changes to our current health order and regulations, so they did not rescind anything. They did not yet vote to extend anything. So they are meeting again on May 19th. They will again look at the data, see where we are. We do not, I will say this again because I keep getting the question. We do not look at one piece of information. It is multiple pieces of information so that we can get a full picture. But they will meet on the 19th and make a decision about the current health order and what, if any, changes need to be made, if it needs to be extended, or if it will go ahead and be rescinded. Vaccinations can reduce infections, hospitalizations, deaths. They can reduce the number of variants and the spread of variants as well. So as the mayor mentioned, vaccinations is the key to this, and they are getting easier to obtain. Appointments are still available. Walk-in availability is there. Free rides are available. Outreach clinics continue to be planned and held. Yesterday, we were at Crestmont Boys and Girls Club and did 60 vaccinations there, and the nurses reported seeing kind of families with Johnson & Johnson. You have to be 18, but they said they saw 18-year-olds with their parents, young adults with their parents coming in. They saw people who travel a lot, maybe they're a truck driver or something like that, and making that second dose appointment was very difficult. So the availability of Johnson & Johnson was what led them to get that vaccine. So there are lots of opportunities. That was a wonderful collaboration. Obviously, we always work closely with the hospital, so we're proud about that. But the Housing Authority and the Boys and Girls Club were key partners in that as well. Monday, we have our clinic at the Convention Center for our Latinx and Hispanic population. We have Spanish-speaking helpers and volunteers to get everyone through so that we can take away language as a barrier to being vaccinated. That will be Moderna, and so it will require a return visit for that second dose, and that will be done on June 7th. Plans are also underway to, and I've talked about this every week, but we are continuing to make plans with our schools for vaccinations once approval is given for the 12 to 15-year-olds. But I will say it again, any day that the clinics are open can be family day. If you are 16 or over right now, you are eligible for vaccinations. So please, please schedule that appointment. Pfizer is submitting for full approval, and we look forward to seeing what comes of that. And I wanted to just hone in a little bit on some of the advantages that I wanted to share about being vaccinated. And these are things I think we've talked about that may go by the wayside sometimes. If you are fully vaccinated and you're exposed, you are not a close contact who needs to quarantine unless you develop symptoms. All that you have to do is monitor for symptoms. If you want to avoid quarantine, if you want to avoid having your child quarantined, then consider being vaccinated. If you play on a sports team and you want to play, you want to attend the game, you don't want your games canceled, be vaccinated when you are eligible to be vaccinated. The capacity to care is the thing which gives life its deepest significance. So I'm going to ask that you show that you care, show the nurses, show the mothers, this is Mother's Day, we have a big weekend. Show the graduates that you care by being vaccinated. Do it in honor of Nurses Week and Mother's Day. Thank you.
Thank you, Penny. I very much appreciate that last reminder in particular. Now we go next to the representative from the Monroe County Commissioners, Penny Gibbons. Penny, we can't hear you. If you could unmute.
There, thank you. Sorry. It's always difficult to follow Penny Caudill on any call at all. Monroe County's processing of CARES funding for county businesses, nonprofits, and other government agencies has ended, but wanted to let people know that our commitment to the health and well-being of county residents has not. We continue to support the decisions of our health department, and we still have Security Pro employees out in the county working with businesses and offering masks to those who need them. So far, the county has provided a total of $80,683 to 148 households through the Township Assistance Program. And I want to remind everyone that each resident of Monroe County lives in a township, and if you need money to help with rent, utilities, or other expenses, please contact your township trustee. A list of the trustees and their contact information can be found in the minutes of the recent Board of Commissioners meetings or at the website of the Monroe County Emergency Management Department. Either of these is found at the county's website, which is co.monroe.in.us. In an effort to support county residents, we have also worked with the county council to provide monies for food. This week, we authorized an additional $10,400 to help Pantry 279, bringing the total amount that we've given directly for food support, and that's in addition to the monies given to places like United Way. But so far, we've provided $105,700 in direct money for food support. I'd like to join everybody else on the call and remind people of the importance of getting vaccinated and continuing to wear face masks when out in, or face coverings when out in public. From everything we hear, whether it's from Dr. Fauci, the Centers for Disease Control, or our own Penny Caudill and Dr. Sharpe, it's vaccinations that are going to allow us to return to our pre-pandemic lives. And I want to repeat what others have said. The development of these vaccines is based on 20 years of research, and the data indicates they are safe and effective. If you've already gotten vaccinated, please talk with your friends, family, and coworkers and ask them to get vaccinated too, so that we can get back to the lives we'd all like to lead. Thank you. It's back to you, Yael.
Thanks, Penny. Monroe County Emergency Management Deputy Director, Kate Petroline. I hope everyone heard that. Kate Petroline from County Emergency Management.
Thank you. Good afternoon, everyone. I would like to echo what Penny Caudill was saying earlier about it being Nurses Week. Our office is so grateful for all the nurses, no matter where you work or where you're at, for all the work that you do. I personally come from a family full of medical professionals. And for me, I am grateful to you for not only doing your job on the clock, but off the clock. So I know a majority of you probably get text messages or phone calls saying, I don't know what this is. How serious is this? Do I need to go to the doctor? So thank you, everyone who is a nurse out there, for doing all that great work that you guys do every single day. Thank you. So to continue with just the updates that we have for our office, I'll let everyone know that the April blood drives were an absolute success at the Monroe Convention Center. We would like to continue that success through the month of May. The daytime slots are scheduled for May 24th from 10 a.m. to 3 p.m. And the afternoon and evening slots are scheduled for May 27th, 2 p.m. to 7 p.m. Again, they'll be at the Monroe Convention Center. And you can sign up for those by going onto our website at co.monroe.in.us. Secondly, we always like to remind everyone that if you like getting those notifications about the COVID vaccine or the clinics and or weather alerts or community events that need to be posted out to the public, please go onto our website and sign up to receive those alerts if you haven't already. And if you do, have your neighbor make sure that they sign up for them. You can go into our website and there's a big old megaphone right on the front page. You click on that, you put in your contact information, you'll be able to receive those alerts. And finally, I just like to remind everyone that we still have some masks available to the community. So if you need a mask or you know someone who needs a mask, please go to our website and we have listings of different places across the county that you can go and pick up a mask. They're free. So again, go to our website, co.monroe.in.us. And that's all I have for today. Thank you.
Great reminder, lots of good information at the county website and at the city website at bloomington.in.gov, where you can also find these press conferences, in fact, archived. So we go next to IU Health South Central Region President Brian Sharpe.
Thank you, Yale. Thank you for supporting today. We appreciate that. Also, what would be remiss if I did not also say that this is National Nurses Week, and starting Monday is actually National Healthcare Heroes Week. It's a week that every year in May, all of the American Hospital Association affiliates celebrate hospitals and healthcare organizations and those who care for patients across our nation. So congratulations and thank you to everyone who supports our healthcare systems here in the nation. We also are seeing fluctuations, as Penny Cottle had said. We are seeing those fluctuations here in our inpatient census and throughout our region. Over the past week, our number of COVID-19 inpatients continued to decline, but they're still in double digits. Here in Monroe County, between IU Health and Monroe Hospital, it's the same story. So this week, we gave out our 80,000th vaccine in the IU Health South Central region. And as you can see, we celebrated with someone who is much younger than I and is a good role model for those who may be a little younger and want to wait on the vaccine. They need to go now and get their vaccine. You might be the 90,000th person to get your vaccine. You never know. As of yesterday, we have given 81,684 vaccines at our Bloomington and Paoli sites. And as we shared a few weeks ago, we will be transitioning our vaccine focus on outreach and operationalizing vaccines in our organization as Indiana University continues to be able to take on more and more vaccine at their site on the Bloomington campus. Our vaccine supply here at Bloomington Hospital continues to be in good shape, as we've utilized 60,440 of the 63,720 vaccines we've received. That's a 94.9% utilization percentage. I also thank the mayor and echo his comments regarding we got to get this vaccine rate up. This is our focus now, is getting more vaccines in arms, and that's really where we need to focus our attention, because everything else will change for the better when we get more vaccines in arms. So on the screen, you'll see a heat map across Monroe County. We continue to make great progress in the vaccination percentages of those fully vaccinated. This is in large part due to the commitment of each of the stakeholders represented here in this press conference each week and the great work of our media continually sharing information. We still have a great deal of opportunity in our neighboring counties where we have IU Health facilities. And so that's why we are continuing to start our focus on outreach so that we can help where these areas of orange and red are, that we can help get vaccines in arms in those locations. The American Academy of Pediatrics reported earlier this week that as adults continue to get vaccinated, children account for more than 1/5 of new COVID cases. 22.4% of new cases reported in the last week are children. So over the last month or so, I've been sharing the concern that we continue to see younger people get hospitalized for COVID. To emphasize, this means that their symptoms were severe enough to result in them seeking medical intervention. More than ever, it's important we understand higher vaccination rates in any age group result in lower infections in that same group. The vaccines are working and will reduce the spread to our youngest populations. We do anticipate the FDA announcement, as Penny Cottle said, on expanding its emergency use authorization for Pfizer COVID-19 vaccine, and that it would include potentially 12-year-olds to 15-year-olds sometime in the next week. We will all need to encourage parents and guardians that to ensure these future leaders, these future doctors, these future nurses, that they need to get the vaccine. And I just want to thank Penny and our IU Health nurses and the Housing Authority and everyone else who is doing these great outreach clinics, getting those who may have some barriers to getting the vaccine to get shots in arms. It is so much appreciated, and we as a community appreciate that work. So I'd like to end my comments by announcing how IU Health is dedicating time and resources across the state of Indiana to increase the vaccination rate and help those still questioning whether to get the vaccine. IU Health begins our Badge of Honor campaign today across the state of Indiana to help lift the message and importance of everyone doing the best thing for our fellow man, getting a vaccine. I hope you will join me, just like each of the leaders on the screen, in rolling up your sleeve and getting your badge of honor.
Very
Thank you, and I will
cute.
take comments.
All right, we'll have, again, to remind, questions at the end of all of these presentations, and we're coming up on our final introductory presentation from IU Assistant Vice President for Strategic Partnerships and IUB COVID Response Unit Lead, Kirk White.
Hey, thanks, Yael. Thanks for stepping in today. You know, we are celebrating commencement this weekend, and that's a good positive note to start out with. System-wide around the state, we're going to be conferring 24,200 degrees at our campuses throughout Indiana, which, by the way, includes 630 new nursing degrees. So we're helping the Indiana healthcare system by those students who have chosen to graduate from IU with a degree from our School of Nursing. Let's click over to mitigation testing on the Bloomington campus. We did not do mitigation testing this week. Instead, we had departure testing and pre-commencement ceremony testing. So the numbers from last week when we did mitigation testing, we did about 16,200 of those tests, and our prevalence rate did inch up a bit to 0.6, which was a bump up, and I think that's reflective of some of the new weather. It's been easier to socialize, these type of things. In particular, we had some increases in some of our student categories, and so we want to stay vigilant. And this week, though, the departure and voluntary mitigation testing and the mandatory testing for pre-commencement went back down to 0.4. So that's a good sign. Let me now switch over to vaccine. Some more good news there. Since March 29th, at our Assembly Hall vaccination site, we're up to 28,100 vaccines as of this morning. So that's a great number. 11,700 of those were in our open pod that's publicly available. And then that special university student and faculty and staff focused distribution has generated 16,400 vaccines since we started that on the week of April the 5th. And along those lines, I noted in today's newspaper that we saw that jump of many thousand. I think it was 6,000 to 8,000 that we did that week of the 5th, and then it went down significantly. Well, that's really because of the large number of additional doses that we got from the state when we started that student focused pod the week of the 5th. So the fact that it's come back down here lately is not a serious indication. It's just that we had a big bump those first couple of weeks of first doses on the week of the 5th and the week of the 12th. So I wanted to make that clarification. Next is, as we talk about vaccines, as was talked about earlier, we're going to be ready for next week when we anticipate the FDA will approve that 12 and up approval. And we are working with the county health department and with the school corporations in Monroe County to make sure we've got plenty of space at the assembly hall site. Again, you can make it a family day, or students could come on their own if they've got parental consent. If they're under 18, they need that. You can pre-register for the assembly hall site at ourshot.in.gov. We look forward to welcoming that 12 and over age group at Assembly Hall. And I know the health department's working on some outreach clinics, perhaps over in the Ellisville area, but we'll be ready for that. And we encourage you to come. We'll be ready to give you plenty of vaccine as soon as that's available. Next is our summer plans. And I just wanted to let you know that we have posted our summer guidance, and I'll put a link in the chat there. Basically, some updated guidance. If you have been fully vaccinated, you will be exempt from mitigation testing. We're still discouraging travel, but it is available for vaccinated people. Will not need to quarantine on university official travel status, but still requires pre-authorization. And we're limiting large events to 25 and prefer that those be outdoors. Basically, we're keeping much of the same protocols for safety in place that we did for spring. The next time we'll be reviewing these is over the summer, and we'll be publishing new guidance for the fall semester that would go into effect on August the 1st. And again, let me just conclude by offering congratulations to all of our graduates and their families, some of whom are visiting in town this weekend, and particularly to our good friend Chuck Carney, who did earn his PhD this past year and went through the commencement ceremonies today. Thank you.
Thank you, Kirk, and congrats again to Chuck. You mentioned the summer guidelines, but I guess we should go ahead when we jump into the questions and just, since you've already been speaking, Kirk, we may as well just have you continue on, because this is a related question from the B-Square Beacon, who wants to know if you can update us on the planned vaccinations requirements for the fall. The B-Square Beacon says the last information they were able to find was very strong encouragement, but not a mandatory requirement. So is that decision still to be made? Who's going to be making that decision, President Whitten or trustees? And then it goes on, but maybe you could tackle that first. Oh, if you could unmute, Kirk.
There we go. We don't have a mandatory requirement yet, but I would say that our medical response team has been studying that closely over the past couple of months, and it's difficult for us to see how we would get back to normal operations without a very high number of vaccinated students, faculty, and staff. So they're still taking a hard look at that. That decision will be made by the president and his cabinet with recommendations from the Restart Committee and the experts from our School of Medicine, and of course our medical response team that meets daily. I would expect that sometime in the next couple of weeks we'll be able to give some additional guidance on that, because we want to give people plenty of time for whatever the decision might be. Since we have plenty of supply right now, it would not be a burden for people to get vaccinated. So as I say, we're looking very closely at that. And right now it's still a strong encouragement. In fact, I was just talking with some student groups that will be arriving early this summer. We're making plans to make sure that they get vaccinated before they arrive.
All right, and this is, if you don't mind, just a bit of a follow-up question about numbers and keeping track of numbers at IU. Also from Dave Askins at the B-Square Beacon. How are we going to calculate the percentage of the population that's vaccinated through the summer and into the fall? So for example, if one person who is vaccinated this spring leaves to graduate and then is replaced by someone who's not vaccinated, how are those calculations going to be made?
Well, first off, we require students as part of their commitment for enrollment to report their vaccination status to us by sending us a copy of their vaccine card. So they're to report when they have either the single shot of Johnson & Johnson or the double doses of Pfizer and Moderna. After they get that second, they're considered fully vaccinated after it becomes fully in effect 2 to 3 weeks after that second dose. So that's how we'll do that, by the self-reporting that they are able to give us. Since that could be a requirement, if it is, that'll make it easy for us to keep track. It's still a voluntary requirement otherwise, and that's what's currently in effect right now. And of course, if you are fully vaccinated, you're exempt from mitigation testing.
All right, thank you. One more question from the B-Square Beacon, and this is for Penny Caudle or anyone else who may know about this. The state dashboard shows 298 single-dose vaccinations administered for Monroe County yesterday, May 6th, up from single digits over the last 5 days. So that's 140 more that were given at the Boys and Girls Club. The B-Square Beacon asks, was there another local clinic giving out the J&J vaccine yesterday?
We did a few. Were also done at Indiana Center for Recovery, but certainly not that many. But keep in mind that there are other sites. There are pharmacies. Our residents may go to other counties that have vaccination clinics that are using Johnson & Johnson.
Yale, in addition, our hospital pharmacy, outpatient pharmacy in our lobby is also giving Johnson & Johnson.
Okay, that's good to know. A question that occurs to me and may to others who are wondering if they haven't been vaccinated yet, where they should go. Of course, we've got rshot.in.gov, but given the plethora of pop-up clinics and walk-in appointments, or lack of appointments that I should say clinics that don't require appointments, where should someone go? What's the first step? Should you register online? What's the best way to get information about where you can get your vaccination?
I would say the place to start is, other than here, of course, paying attention to us, but Our Shot is the place to go to see where all of your options are, and then find what works for you. And if you keep in mind that Pfizer is 16 and up, but Moderna's 18, Johnson & Johnson's 18, but just find the vaccine that you can get to the easiest. And that is where I would say you need to go. And certainly any of the sites here in town are ready and waiting for you and willing to see you, but just go where it is convenient.
Penny, is 211 still a call people can make too if they have trouble?
Yes, it is. And if you do schedule an appointment for instance, Assembly Hall or at IU Health or any of the state funded sites, you have an appointment and you need transportation, 211 can also help you get a voucher for transportation. And I know that IU Health also has transportation available as well.
So the important thing is just to go to the website and look for that clinic nearest you. Do any of the presenters have any follow-up comments you'd like to make at this time? We're all talked out. Well, seeing no additional comments from the media, I think we can safely say that we have answered all of the questions in the world today, and we can go into our Mother's Day weekend with some confidence, I hope. With that, and with continued emphasis on getting vaccinated, I think we can bring this week's conference to an end, and we will reconvene next Friday, most likely with the stalwart Chuck Carney in my seat at 1:15. So I thank everyone for joining us today. Have a wonderful weekend.
Thank you,
Thank you
Gail,
very
for
much.
your help.
Everybody.
Appreciate it.
Happy Mother's Day.
Thank you.
A good weekend.